Susanna, it's a great pleasure that you've joined this podcast. I'm really delighted to see you, hear you. And we're going to get stuck in with a first question of, why does integrative medicine matter to you?
So firstly, thank you very much for having me as a guest on your podcast. It's really lovely to be here with you. So integrative medicine is really, really important to me because I think it's that truly holistic approach, and it's something that, looking back intuitively, I'd always try to practice that way, right from when I was a medical student, junior doctor. Although it wasn't something that I was taught or kind of modelled, but that's how it felt right to talk to patients about nutrition and about looking after things like to do with, what we would now call awe and being in nature. And I realised that I was encompassing these things, but not really knowing that I was doing it or kind of what to call it, and feeling I needed to kind of do it secretively. And then it was actually through finding out about the prescribing lifestyle medicine course with Rangan Chatterjee and Ayan Panja that I went to that and first heard doctors talking about holistic medicine in a really kind of public way, and that this course had Royal College of GP approval, kind of gave it that stamp of kind of wider medical approval to encompass all of these different things. And that led me on to doing some training in functional medicine. But I still always felt that there's functional medicine is a piece, but it's all of the other bits that integrative medicine brings in. It's having that complete holistic approach. So for me, using all of that blended with a trauma-informed approach is what I think is the best, most holistic, most successful way of healing, both for the practitioner and for the client.
So it sounds like that trauma-informed piece, it felt like it sat together with integrative medicine for you. Talk to us more about what trauma-informed medicine is about.
So, I mean, the kind of the standard framework of looking at trauma-informed practice, which so there's like these 4 R's that come actually from America, from the substance misuse. I can't remember what it stands for, but it's SAHMA is the acronym, and they released this framework that came out 11 years ago from America, which we're now adopting here only in the last kind of year or two. And that framework is all about acknowledging that trauma exists, being able to recognize it, working with people and trying to actively not re-traumatize them. But for me, it's kind of taking it broader, that we actually acknowledge the prevalence of trauma, and that we're then understanding how that really impacts people on every part of their body, and not only mentally, but also physically and also emotionally and spiritually. So it really impacts everyone in that true holistic way. And therefore, the only way to really heal that is to approach it holistically. So traditionally, we only really use talking therapies, and that addresses the kind of cognitive side of it, which yes, is a part of it, but it doesn't address how trauma is stored in the body, and it doesn't address necessarily the spiritual aspect and the way people's just whole worldview shifts. So it's taking that really holistic approach that integrative medicine does in healing is really, for me, it just goes part and parcel of trauma healing.
Yes, and your teaching has been super relevant to me because we've talked about this, having a very physical experience of burnout without really recognizing what was going on for me, with a few ACEs in my life, which are these adverse childhood experiences, and then some, big trauma with the death of my brother. But I think that what I didn't realize was how I was re-traumatizing myself with my area of medicine, end of life care, working with a lot of despair. And what your teaching also helped me understand was this idea of empathic strain. So talk to us a little bit more about some of these elements that you see. We're talking in a way at the moment, I'm talking about a healthcare provider.
Mm,
I was recognizing trauma in my patients, but not recognizing trauma in myself. But just to answer you, that this mind, body, spirit approach was super important for my recovery. And
mm,
I think it's very important what you're saying is that once we've identified there's trauma, how do we heal it? And
mm.
I love the way that you use the word heal.
Yeah. And I think you've touched on something that feels really important that I think we just don't really acknowledge that, yes, as healthcare practitioners, we're obviously looking after our clients, our patients, and that's what we're there for. But it's very hard to do that if we're not okay ourselves, and to be in that space where we're constantly giving of ourselves, because to be a healthcare practitioner, you have to give of yourself if you're going to do it well. Let's say, if people do that, but to really have that shared empathy and compassion for somebody and really understand where they're coming from and tune into what they need, you are giving of yourself. And in order to do that well, sustainably, we need to be able to know how we are and understand ourselves. So there's a different kind of parts of this. So the first part is acknowledging, if we understand, or if we accept that trauma is prevalent in our society, then we have to also accept and acknowledge that healthcare practitioners are part of those statistics in society. And so we come into the profession with that baggage already. And within medical training, which is my background and what I know, there's no supervision, there's no proper mentoring. There's certainly no kind of therapy or coaching that is in any way ongoing to make sense of what we're seeing. And so we're throwing in 18, 19-year-olds into a very high pressure environment. Those who get a place at medical school tend to be high achieving perfectionists.
Mm.
Then they're in that environment of seeing things that are really difficult. We're seeing a lot of death, despair, disease, poverty, abuse, and there's no way of where to put the emotions that come up with that. And if we haven't acknowledged that individual has trauma, and if they haven't been able to do any kind of work around that, which most 18, 19, 20-year-olds haven't, then they will likely get re-triggered and not be aware of what's going on and not understand that. So
Carry on.
So either people can kind of put a wall up and barriers to protect themselves and start to lose empathy, to kind of have less empathy and less compassion because they just can't do that and kind of have a barrier. Or the other thing that tends to happen is that because they want to help, and in that way of that wounded healer just really wanting to help and really wanting to be of service, and often this is subconsciously that people don't quite realize this is what they're doing, but they want to help what they see in the person in front of them as that part of themselves that wasn't helped. They want to help the other person.
Mm.
Then they just give without having an understanding of boundaries, without understanding where they end and the client or patient begins, and how to have a healthy boundary to maintain their energy and their well-being. So they give and burn out. So
Yes.
having that understanding of trauma, the impact of not only training but then working in that space without any support, it's really important. The reason why this is so crucial, I mean, obviously it's, to get better outcomes for the client, and obviously that we avoid burnout, but it's not just, the point is not just about recognizing it. When we recognize it, there's so much we can do to help, not just get those practitioners feeling better, but to prevent it in the first place. And that's what's so crucial, because surely, if we can prevent people getting to that place, then it's just better all round.
Yes, and I remember, when I was a palliative care trainee dealing with really difficult situations, I asked for supervision, and I was asked, have you got a problem? And I said, no, I haven't got a problem. I just like some support, because I thought it was really curious
Mm,
that we don't have any supervision or mentorship when doing such a complex role.
Mm.
And what was interesting, and again about avoiding it, is actually I avoided burnout in that team because I did have supervision from the psychologist, clinical psychologist, but there were two others who got really quite unwell. And
Gosh.
so, yeah, it's curious, isn't it, that we
Mm.
might feel that we would be invulnerable from those stories that we're meeting every day.
Yeah. It's baffling. And I mean, I initially started training as a pediatrician and went kind of down that route and did a lot of training in neonates. And at the time when I was training, consultants weren't in the hospital overnight. And so, you know, one minute I was an A&E trainee doctor, and kind of the next day I was a pediatrics and neonatal junior doctor. And the very first night, so the first shift I did was a night shift, and there was this, unfortunately, baby was born very, very unwell, and I had to accompany them in an ambulance across London with the father in the back of the ambulance with me, and just told to make sure the baby stayed alive until it got to the tertiary hospital for surgery. And there was no debriefing afterwards, no, you know, checking in how I was. And as you know, when you're in that neonatal space, that you're confronted with life and death constantly. And there was just nothing,
Mm.
no kind of support at all. And then when I went to change to training as a GP, so going into general practice training, I also asked my trainer about supervision because I had a friend who was doing psychiatry and he got supervision. We see loads of mental health and you know, it's most of kind of what you see as a GP. And I'd had all of these other experiences. And so I knew then, I guess I had a greater understanding of when mothers were going into labour and what that neonatal period looked like because I'd kind of been there. And just again, similar to you, the response I got was, "Are you just not cut out for medicine? Are you just kind of
Yeah.
a bit, you know, perhaps this isn't the right career for you?" Rather than thinking, "Wow, you know, this is someone who's really proactively wants to look after their well-being," with that idea of longevity in the profession. It just seems very odd.
Yeah, it is. It's odd. And I remember we were in the large teaching hospital where I worked, and we had a senior management meeting, and uh, the senior manager said, why will the junior doctors never come into trust headquarters? And I said, maybe it's because it sounds like a bunker and that you're in a war zone. And what really had struck me was that we didn't understand the language of medicine was
Mm,
about working in a war zone where you will often work beyond your capability,
yeah.
you'll work long hours. And this, I think this is how medicine grew out of that model. And it's really struggling to shift into a new, more balanced
Mm.
model where self-care and care of others is seen as equally important.
Yes, yeah, absolutely. And I think if we look at how things have changed over the last few decades, that, you know, 30, 40, 50 years ago, patients stayed much longer in hospital. The acuity or the degree of unwellness of patients was less in hospitals. I mean, people went in very unwell, but they had a longer convalescent period. So you had a range of people who were very sick and those who were recovering. But now, as soon as somebody is, you know, vaguely okay, they're moved out to the community, which is obviously much better for patient outcomes because the longer people stay in hospital and they don't get up moving, we know that, you know, that impacts recovery in a negative way, and it's much better for people to be in their own environment. So it's much better for patient care. But what we've not looked at is the impact on doctors, is that what they're seeing is really sick patients all the time. So there's no
Mm,
kind of breathing space at all. And the other thing
mm,
that's changed is how, in order to reduce the working hours in the week, which again is a good thing, then doctors are doing shift work where they're belonging less to a firm. So when I was training, they were kind of, it was just kind of shifting between those two models. But we still, for the most part, had what was called a firm where you're attached to a consultant who has a registrar and then one or two what were called senior house officers then, and then a house officer. So you kind of were in this structure. And they all knew you. Now, whether you got on with them or not was kind of irrelevant, but you had that sense of belonging. And
Mm,
now you don't have that. You're kind of in a pool of doctors doing a speciality where people know you less. The training per speciality is you change every 3 to 4 months. So again, there's not that time for the senior doctors and the nursing staff, and other allied healthcare professionals in the hospital to really get to know the junior doctors. So it can feel very kind of anchorless and and
mm,
and kind of drifting through these specialities where you're seeing really unwell patients and you're just left to deal with it. And because the
yeah,
staff haven't got time to get to know the junior doctors, they're not going to be in that position to recognize when they might not be okay. And
yeah.
because they just, everything keeps changing. So that way of looking after staff, I think, has really changed. And the other thing, actually, I think when I was a house officer, the hospital, I mean, I did my house officer job, so that's like the first year out of medical school. I did that whole year in one hospital, teaching hospital in London, and we had a mess. So it was basically a pub within the hospital, which, now people consider that's kind of not a good thing. But actually, it was great that all of the staff kind of went there after work for a drink. I mean, not all the staff, but, a lot of them. And you just could have that space to decompress, and that
Yes.
kind of space for gallows humor, to just have, people to understand the context of what you were talking about and what you were struggling with. And it was like an acknowledged place that was kind of safe to say when things were difficult, and people got it and understood it. Whereas if you talk in that way outside of that space to, I mean, obviously confidentially, but if you talk to a partner or friends who aren't within the medical space, they just don't get it. And
Yeah.
so all of that, we've lost that. And so I think it's becoming even harder for junior doctors now than it was, say, 20, 30, 40 years ago. And we're not really acknowledging that.
No. And so what you're saying is complexity's gone up,
Hmm.
being able to have any spare time's gone down, sense of belonging with your tribe has also reduced.
Yep,
And the mess again would be a word from the army,
it's true. Yeah, it's true. I hadn't thought about that. Yeah,
the officer's mess.
yeah, that's true.
And so it strikes me that we've had to move away from that patriarchal model, but we
Mm,
haven't worked out what model we're moving into that would allow people to cope with that level of complexity.
mm,
So I wanted to ask you a question for our listeners and viewers, which is that some people might know about that term PTSD, post-traumatic stress disorder. It
mhm.
was on the radio this morning with some of the London bombing, but
Yeah.
people wouldn't necessarily know what that word trauma means or even assign themselves
Mhm.
as having issues with trauma. Could you kind of define that a little bit for us so we can understand better?
Yeah. So PTSD, or post-traumatic stress disorder, is a medical label. It's a medical term. And in order to get a diagnosis of PTSD, you need to kind of fulfill certain criteria. And so that would then suggest that if people don't fulfill those strict criteria, then they don't get that diagnosis. And that almost then implies that they're fine. So I tend not to use the term PTSD and talk instead about psychological trauma.
Hmm.
And so psychological trauma can impact people for lots of different reasons. We tend to, the terms initially come from things like shell shock, come from the war. And so traditionally we tend to think about war, combat, big events, that it's only those that psychological trauma, impacts of psychological trauma, or PTSD. But we're now recognizing that the causes are far broader. So they can be from any kind of childhood abuse, whether that's physical or sexual, or emotional neglect, emotional abuse, bullying, either as a child or an adult. But it can be anything that really threatens that individual's threat to life or threatens their worldview. So, for example, for what we might as an adult not necessarily see as really life threatening, to a 3-year-old, it would be, because they don't have that context. So when traumas happen, makes a really big difference to how we perceive it and how it's then retained in the body. And also, it's not just the traumatic event. So not everybody who experiences or lives through an event that may be classed or deemed as traumatic goes on to have consequences of psychological trauma. It's really important to understand it's not just the event, it's what happens inside of us after the event. And a big part of that is how we're met in that immediate aftermath. So with some big natural disaster or some kind of big rail accident, there's people can visibly see that. Obviously, all of these things are horrific and, there's no kind of grading or hierarchy around it. But when people can visibly see it, there's a response and people understand that individuals may have been impacted. But with something like intimate partner violence or emotional abuse or sexual abuse, these things are behind closed doors, and it's then one person's word against another. And so often then people are not believed. And when they're not believed and that trauma is not acknowledged, then people turn it inwards on themselves and become then very self-critical and blame themselves. So trauma is essentially an event that is catastrophic and changes somebody's worldview, but it's then what happens inside that's the problem, and inside of the body. And the brain, when it's a non-traumatic event or thing that happens, the brain will file this event away in a kind of a time-bound way, or your brain kind of files it in a logical manner. With trauma memories, it's often filed away in sensory around. So we can remember when something happened, we'll remember smells and sights and tastes and sounds and feelings and touch, and that's why it's kind of held more in the body. And that's why the classic that we think of as, if a car backfires and a soldier walks past, then it's like a gunshot. That's why we have those the kind of the auditory flashbacks. But flashbacks can also be smells or touch, because it's all to do with the senses. So really looking at trauma healing, that's why it needs to encompass, like we were saying earlier, not just the cognitive part, but also what's going on in the body. And so people can have flashbacks and be triggered by things. All of this is going on subconsciously. It's not like your brain thinks, oh, that red car reminds me of the car that I had an accident with when I was 10. All of this is subconscious. And so because it's subconscious, we don't realize it's happening. And so that whole acknowledging trauma is so important, because then when we start to piece things together and link it, and we can then acknowledge it, externally by someone else acknowledge it, then we can acknowledge it more easily internally. And then we can start to be curious and notice what's going on in our bodies in response to different situations. And then we can start to look at how to unpack that and how to heal.
And it sounds like our understanding of trauma and the trauma response has really evolved. But getting support in early is important, because isolation seems to make the whole experience a lot worse. You talked about trauma healing. Can we open that up a little bit more? Like, what are the different approaches that we can use to heal trauma?
Yeah, and I think fundamentally the thing to kind of remember is that all of the responses of traumatic incidents are entirely normal responses to an abnormal situation. And the problem is that when the brain and body doesn't see that that traumatic event is finished and the body and brain stay partially stuck in it, then we stay partially stuck in those responses. So initially those trauma responses were survival responses, and without them, none of us would be here. The problem is when we stay stuck, they no longer serve us. And then they can change how we behave, they impact our physical body. And that's where we end up having then problems potentially in relationships, in belief in ourselves, and these physical problems. So trauma healing starts with that acknowledgement that there is nothing wrong or broken with an individual. I hear that so often, that people have been told externally, well, there's just kind of something wrong with you. And they feel that they are broken, that they're somehow flawed. When actually, without those original trauma responses or survival responses, they wouldn't be here. So there's a part of just acknowledging what happened is an entirely normal response, and kind of thanking that part and thanking that response. And then it's looking at what feels right for that individual in terms of going down the healing route or the healing path. And it's so there's a couple of different ways of looking at it. So the first thing is looking at, for some people, it's really important to verbally talk about what's happened to them, to have a witness, to hear what they've said and almost to validate what they've said. So speaking to somebody in terms of talking therapy can be really therapeutic. So talking therapy certainly has a place and can be really helpful. For some people, talking about what happened re-traumatizes them and actually makes them worse. So for some people, they don't want to go down that route. They don't want to talk about it to anybody. And the problem is, because that's really all we have on the NHS, people tend to think, well, if I don't want to talk about it, then I can't be healed. There are no other options. And that is absolutely not true. There is so much that can be done. So the other part, like we keep mentioning, is looking at the body. And so there's lots of different types of specific trauma healing that can help with the body. So things like TRE, so trauma release exercise, or something like somatic experiencing, modalities like acupuncture or craniosacral therapy can be really helpful in healing trauma. The other kind of way of looking at trauma healing is to recognize that those original responses, those original survival responses, were part of our acute stress system, our acute stress response. And that acute stress, like I keep saying, if we didn't have that, we wouldn't be alive, we wouldn't survive. So we need that acute stress response. But when that's not switched off, when we stay stuck in it, then that acute stress becomes chronic stress. And that chronic stress in the body, when it stays around, becomes toxic stress, and that leads to inflammation. And it's inflammation that really causes problems throughout the brain and the body. And where it stays and where it kind of manifests in the body will have a lot to do with genetic predisposition and other things that have kind of happened in our life and our lifestyle. So there's lots of different factors. But if it's more neuroinflammation, so to do with it's that kind of staying more in the nervous system, then it may manifest or may show itself as things like depression, anxiety, fatigue, brain fog, migraines. And if it's more in the physical body, then it could be anything from skin conditions, autoimmune conditions, fibromyalgia, gut conditions. The list is endless. But the point is that all of these conditions are inflammatory. And so doing anything to reduce inflammation will help that person heal.
I think this is really important,
Yeah,
Susanna, because this is something around how the integrative healthcare model has
exactly.
assisted with our understanding of inflammation, which even 5 years ago was regarded as niche ideas. And now we've realized that without an understanding of, and you beautifully described how inflammation can show up in different ways in different parts of the body.
Yeah, yeah. And I think, and what I really want to emphasize here is that this is all evidence-based. This is all backed by scientific research. So, I mean, there's a really important study, if no people haven't looked at it, called the ACE study that came out in the late 90s, showing the links between adverse childhood experiences and how that leads to inflammation and how that impacts physical health in later life. That has been repeated over and over and over again. And since then, there has been so much research, so many studies demonstrating how trauma, not just adverse childhood experience, but other traumatic incidents, other traumatic events and situations, cause inflammation that is measurable in the body. And that when we reduce inflammation, that helps the body heal. Because ultimately, the way the body is natural state is towards healing. So if we can create that environment for the body, and that's inside the body, but also outside, so the internal and the external environment, if we can create that and keep that into reducing inflammation and keeping that into a calm and healing environment, then the body can do its thing. You know, we're giving that space and that environment for the body to do its healing, which it can do. But so
And
often we ignore that.
we do. And I think that's super important to remember and gives hope to people that
Exactly.
the body is hardwired to heal. The body's really hardwired to find balance. It's something in
Yes.
medicine we call homeostasis. And when we get out of balance, the body is trying to find ways to communicate. And I think I just want to come back because, just to define a couple of things that listeners might not have understood. But I also just want to say that the body is intelligent, again, is
Mm.
part of an integrative medicine model where rather than do things to the body, you listen to it. And I just, that somatic experiencing, some people might not know what that means. Can you say a little bit more about that?
So somatic means kind of from the body, and so the kind of the physical body. And so this is a healing modality that was developed by somebody called Peter Levine, and he's one of the pioneers in shifting how we think about trauma now in the present day. So looking at his book Waking the Tiger, or another really thin book that's really great from his, is called Healing Trauma. It's just really, really helpful. People can do a 3-year training looking at somatic experiencing, which really looks at how the body responds and reacts and working with that rather than necessarily talking about the traumatic incidents in detail. There's other things like EMDR, so which is eye movement desensitization reprocessing, is what that stands for. Again, which can be used often in part with talking therapy, but it's where you don't have to talk about the trauma in detail. So with anyone who is looking for talking therapy, I'd always look for somebody who has, well, actually any practitioner is looking for somebody who's got a varied toolbox. So when people just do one thing as a kind of real purist, that doesn't always suit a practitioner, a patient or a client every day throughout their journey of healing. You might need one element one day or another element another day. And so looking at somebody who perhaps uses EMDR and perhaps also understands somatic psychotherapy. So again, it's body psychotherapy, where you can work then in tandem with somebody who is a body worker. So somebody like who does something like acupuncture or craniosacral therapy. It's looking at all of those things together. And like we were saying, it's people can also do a lot on their own. So looking at consciously moving the body, whether that's dancing or doing yoga or swimming, or there's lots of things that people can do when they're consciously shifting and letting go of emotions and feelings through the body, can be really healing and therapeutic. That is helpful to do with a practitioner, but people can do a lot of this work on their own as well.
Yes, if you're building awareness through various practices, like, insight meditation would be another one where you allow sensation to arise, feelings, thinking. When you're driving awareness, there may be things that you really can start to put into your daily practice to
Mhm.
support this balance or healing. There may be some people listening to the podcast for whom trauma is running through their bodies, but they haven't been able to connect yet to a good therapist. And I would say that somebody who really understands trauma can acknowledge it, can work with it, and then sometimes recommend out again, to
Yeah,
other therapists that might support them. I
yeah.
just wanted to say that over many years as a medical homeopath, I didn't have this framework of trauma to work with, but I found that people would describe physical sensation that by staying with it, they
Mm,
would then get deeper into a deeper experience of that pain or sensation, and then into feelings. And then sometimes they would describe trauma of various kinds. And, that again, that reminds me the body's longing to express.
mm.
And if given the right environment, it will express the deeper underlying element that is, yeah, is activating it.
Absolutely. And I mean, it's something that, I had always had an interest in mental health. And, as a
Mm,
GP, most of what we see is to do with mental health. And I didn't recognize in myself that I was carrying a huge amount of trauma from, early adulthood. And that only became, you know, devastatingly apparent about 9, 10 years ago, and I became really unwell, and was then diagnosed with complex PTSD. And I couldn't believe that I, as a GP who kind of felt I specialized in mental health, didn't recognize this at all, because we don't learn
mm,
about it. I didn't have, like you said, didn't have a framework. I didn't have an understanding of what this meant. And so it was only then when I started looking into this to try and find my own path to healing, that I found all of this stuff out there, that, all of this research of recognizing trauma, the causes of trauma, and, like we've been saying, all the different types of healing. And so for me, talking therapy was a big part. So talking therapy with EMDR, somatic psychotherapy, brain spotting. I mean, it was, I had a therapist who did lots of different things, but that on its own wasn't enough. So I needed to then do body work and lots of other things. And that's why that whole integrative approach is just so important. And
mm,
for people to really understand and believe that hope, that healing is possible. And I genuinely
mm,
believe healing is possible for anybody. And we need to get that understanding out there so people can really have that hope that they can change. They don't need to feel controlled by past experiences and past events, that there is a way through it. And the more practitioners can understand about it, and the more people in the public can understand about it, then collectively we can make that change.
yeah. And I do believe that. And I feel like both of us were working through a time, where we weren't, I didn't have that awareness. And it was
Mm,
actually having to recover,
mm,
sometimes with a feeling that I wouldn't, so
yeah.
without hope. And what I found so helpful about some of the body work is the way that the therapist would work in ways that other other people couldn't. Like my GP, I remember taking a dream um to the GP just because I'd had it the night before, and
Mm,
I knew this dream was a dream of hope, that I was finally making a recovery. And I've
mm,
never seen anyone look more worried. And he kind of turned away and started typing. And the message he was giving me was, I hope this woman stops telling me
yeah.
about her dream very soon.
Yeah.
And I think that's when I got integrative medicine, because he'd been wonderful in other ways. And I
Mm,
thought, oh, okay, everyone is like a mosaic, that
yeah.
everyone's offering a little part of the whole of healing.
Absolutely. And I think so, exactly that you don't want to dismiss things. And I think it can be really
Mm,
dangerous to say, well, we don't want any of that and we only want to do this. It's very
yes,
much having that integrative approach. And with that is respecting different modalities. And so it's
absolutely.
so crucial to
Yeah,
not dismiss conventional doctors, because they have huge
yes,
amounts of wisdom and knowledge
yes.
and healing approaches at their
Experience.
fingertips and
Mm,
experience, as do what we would think as the non-conventional approaches. And
yes,
and exactly what you say, different people and different approaches bring different things. And when we can acknowledge that and open that up, and have that curiosity that we can learn from each other, then we as practitioners benefit, because it's, we can learn and find different ways that we can support our clients and ourselves. But obviously the clients benefit, because they have then that shared wisdom from the people around them. And it makes such a difference for the client who's kind of in the middle, if the practitioners who are supporting them respect each other. When there's that lack of
absolutely.
respect and
Yeah,
criticism, it makes the patient or client in the middle really doubt and question what anyone's saying and themselves. And that is
yes.
not an environment that is conducive to healing. So it's, even if we don't necessarily understand something, we can look at it with respect and curiosity. And for me, that's really crucial.
And I remember one client describing it as being caught in the crossfire, and that's the last thing you want to do.
Yeah.
So we're coming towards the end of the conversation, and I'm going to ask you a really big question, which is how would you apply your learning and this model to heal the health service? We've talked about, the plight of the doctor in this new arena without the belonging,
Mm.
without the connection and with more complexity. Can you see ways that this model could bring healing to the health service?
Yeah, absolutely. I think there's so much that could be done, and absolutely that we really could heal the health service. But we need to firstly acknowledge that trauma exists. So not just traumatic incidents kind of out in the community, but that medical training and working in the healthcare system is inherently traumatic. And we need to make the decision that we want to do that. We want to make a change and we want to use a trauma-informed approach because it's not hard. It doesn't, it's not, it's not really complicated, and it doesn't need that much time, but it needs a conscious choice to make that decision. And when that decision is made, to look at having training around a trauma-informed approach throughout medical school, throughout nursing training, throughout any kind of health professional training, throughout the manager's training. But that training doesn't need to be long. I mean,
Mm.
when we've had conversations or when I've done training for an hour and there's other trainings out there, it doesn't need to be something really long and in depth, but it's people just understanding that trauma lens and making sense of these symptoms and being able to put things together that then there's clarity around it. And then you give people that confidence of how to recognize it, what to do when it arises, because it's not an if, it's a when, because it's all around us. And just using little phrases of acknowledging trauma in patients and how to look for it in ourselves and in our peers. There's then so much that we can do. So it's just shifting that understanding and making that choice. And then there's other things that follow. So looking at how we look at having more of an environment of encouraging self-care, of reflection, of debriefing. And we're edging towards those things, but it's about having it in a framework that is really at the core, acknowledging that trauma exists, and then everything else will ripple out from there. So I totally think
Yeah.
it's doable. And if we did take that approach, or when we do, because I'm optimistic that we will, that will make a huge difference for the practitioners. We see so many practitioners and doctors who are burning out, who are leaving the healthcare system. We would help stem and reverse that. It would mean, therefore, that patients have much better outcomes. And that in turn then will save the health system so much money. But at the
Yeah.
core of it, it's human experience, and we would change so many lives for the better. So for me, it's something that it's just a matter of time that we're going to change.
Yeah, we have to change. And a bit like our our mutual experiences of getting ill, I call it being hijacked by an illness. You have to get well. And when you have to get well, you really start to look out. And I agree with you. I think there has to be a, a joint decision
Yeah.
that we want to do it in this way. And that is a challenge because of the way the NHS is run by different political parties, and different think tanks have ideas, and then
Mm.
it kind of breaks it up a little bit.
It does, but I think that's where it's taking that longer term view. So it needs somebody
Mm.
who is brave enough and courageous enough to say, actually, this is what we need to do, because it
Yeah.
just makes sense. And this is something that for the to have a legacy of a healthcare system that is sustainable, that for the healthcare practitioners, for the patients, like it's just something that makes sense, that it's that we're in a position that we can't not do it. And given how the healthcare system is at the moment and how much money it's costing, the whole system is really struggling. And it was struggling before COVID, and now post COVID, it's even more fragmented and kind of on its knees. And practitioners are really really struggling, and many are walking or kind of showing their dissatisfaction with their feet and leaving the profession. And we just can't continue like this. So something needs to change.
Yeah, and I've loved watching your voice get stronger and clearer, and you're going to be one of the people to heal the health service. So thank you so much, Susanna, for sharing with us and all the work that you do to teach people and to help them understand for themselves and for others how to recognize the way trauma might play out in our lives. So thank you.
Thank you. Thank you for inviting me here. It's been really good to talk to you.